Thank you, Madam President. I do want to talk about the President's nominee to the Supreme Court, but first just a couple of response comments to the Senator about health care, because I think if the record be known to Americans, the preponderance of health reform legislation that has been presented over the last 5 years here in the Senate has come from Republicans. And the Democrats have consistently blocked any reform that would make health insurance more affordable and available to Americans. Their goal appears to be not patient-centered care, but government-controlled care. If you look back just a few years, the President, along with all the Democrats, voted against interstate competition between insurance companies. It's hard to say they're not on the side of insurance companies when they vote to prevent a national market, a national competitive market, that people all over the country could buy policies that were more affordable and perhaps match their needs much better than the ones that they can get in their own states. Today, Americans can only buy health insurance in the states where they live. That means a few insurance companies can dominate the market. This is something that we've tried to change. We've introduced. The President has voted against it. We've also proposed tax fairness to Americans who don't get their health insurance at work. The other side seldom discusses the fact that when you get your insurance at work, you get some pretty big tax breaks. The companies that provide that health insurance do not have to pay taxes on it. They can deduct it from their, it's a business expense. And the employees don't have to pay any income taxes on the benefits. If it's an equivalent benefit of over $3,000. The bills that we've introduced as Republicans would give health care vouchers to every American. Every family would get $5,000 a year to buy health insurance if they don't get their health insurance at work. Every individual would get $2,000. In addition, some lawsuit abuse reform and some block grants to states to make sure that people who are uninsurable, who have pre-existing conditions, can buy affordable insurance. The Heritage Foundation says that one of the Republican plans would have 22 million Americans insured within 5 years. They're plans that work, but unfortunately the other side will not even discuss plans that don't have more government control involved with them. What we can do is make what is working work better, and we don't need to replace it with what's not working. One of the reasons health insurance is so expensive today, a third more expensive, is that the government programs of Medicare and Medicaid don't pay their fair share, and those costs are shifted onto employers and to individuals who have private insurance. We don't need to expand the part that's broken in health care. We certainly don't need to expand a cash for clunkers type of health care system for America.